So the next part that I want to talk about is the pelvic or the hip girdle. So when we talk about the pelvic girdle, the thing that you need to realize is that when we're looking at a pelvis, it's actually made up of at least 4 different individual pieces. So the first piece is what's known as the os coxae, and that is the actual hip bone. So if we take it apart, this is what it's going to look like. This is the os coxae. Okay, so this is kind of the, when we're looking at it this way, it would correspond to the right side of patient, essentially. And so the other bones that make up the pelvis, you've got the 2 os coxae, then you've got the sacrum, and then you've got the coccyx. So those are the things that make up the pelvis. So on each one of the os coxae, there are a couple of different bones. The first one is this very broad bone, which is known as the ilium. The one toward the front that's a little more pointed is the pubis, and the one on the back that's a little more rounded is the ischium. So there is a little way of remembering this, and there's a little dance that goes with it. But the riddle is you lean with your ilium. So when you put your hand on your hip, you're putting it on the ilium. You actually sit on your ischium, and then your pubis is like your pubic bone. So the riddle usually is you lean with your ilium, you sit on your ischium, and you don't talk to your teacher about your pubis. So that's kind of how those bones are arranged. So when we're looking at the full pelvis, we've got the iliums, we've got the ischiums kind of that are larger, and then the pubis is going to be toward the front. So if you notice the pubis and the ischium, those are ones that people usually get a little more confused. You'll notice that ischium is quite a bit thicker than when you look at the pubis. So this one is going to handle a little more weight. That's actually what you sit on. So when we look at the full pelvis, the other part that you're going to notice is this cartilage that's in between. So I've got 2 pelvises here, and both of them have that cartilage. That cartilage is known as the pubic symphysis. The other thing is we want to kind of tell the difference between male and female. So when we're looking at these, there's a couple of things to look at. The first thing is usually women have wider hips. So if we look at these 2 kind of side by side, one in front of the other, the hips on the female are wider. So this one's female, this one's male. The other thing that you can look at is actually, if you look at the pelvic cavity here, you'll notice the females is quite a bit larger than the males. Remember that women are adapted for childbearing, so they need a larger pelvic inlet is what it's called. The other thing that you may notice as well is when we're looking at the sacrum and the coccyx on the male is going to basically be pushed forward. So this coccyx is going to point anteriorly or ventrally. On the female, we have similar, but it's got a little more give to it, and you'll notice there's more space here. So on that, once again, the whole point is this area is going to be larger. Another thing that kind of indicates male versus female is if you look at this pubic arch right here, and you look at it here, you'll notice that this angle is much wider. There's a lot more space here, and there's a lot less space here. The reason being, once again, is because the female pelvis is going to be a lot larger. Another way we can look at that is by looking at it upside down. So once again, looking at them, you'll notice this one is much narrower. This one's quite a bit wider. And once again, main reason is women give birth, men don't.